I actually like nephrology because it's a very kind of math-heavy part of medicine, and I do have a background in math. That's what I did in undergrad. And when I started doing internal medicine, I kind of learned a little bit more about nephrology in that regard, and it just kind of gravitated towards it. I like kind of thinking things through in that way and kind of approaching patient care in that way. The first visit very often is just kind of getting to know the patient, having them kind of understand who I am, what my specialty is, and then we try to basically address depending on what the problem is. So if it's chronic kidney disease, we try to figure out what the etiology of it is, what to expect moving forward. Is this a one-time visit that they will just be requiring? Is this something that we're going to have to see each other every few months to keep an eye on things? So we try to kind of get through all that together. When you meet someone for the first time, if you get to see them over and over again and you kind of establish that relationship with them, you know them very well, they know you very well, it becomes kind of a first name basis. As nephrologists, we're kind of involved in a lot of the many healthcare issues they may be kind of working through. So there just becomes that kind of relationship and that familiarity with one another, similar to what they would have with their primary care doctor. So in a lot of ways, we have a very similar type of relationship, and kind of like how a lot of patients become very familiar with their primary care doctor and they know each other very well and they go to clinic. A lot of instances can be completely resolved, and obviously that is very, very rewarding. When a patient comes in with very severe swelling and unfortunate kidney disease and we're able to get a diagnosis and kind of work through the treatment together. Communication is key, so I do try to get kind of to the my chart messages relatively quickly. If I'm at my desk and I get a message, I'll try to respond to it right away. Obviously, sometimes there are instances where it may take a day or two, but I really do kind of like that communication in a timely fashion so that patients can kind of get their concerns addressed.